Hello class, this is a review of chapter 18. We're going to be discussing the gram-positive and gram-negative cocci of medical importance. So we're going to start off with the gram-positive ones, and in the chapter outlines there's a more detailed chapter outline for chapter 18 that you're going to find. So you can use that to follow through. So the first gram-positive organism to talk about will be the Staphylococci. So there are some general characteristics that they all share is that they are that we find them on our skin and mucous membranes. So they are part of the normal human microbiome. They are gram-positive. They are arranged in clusters of spherical cells. They do not have the ability to make spores. They do not have flagella. Some species have the ability to make capsules, and we're not going to obviously learn about all 40 species, but there will be mentioning of some of them. Okay. We'll start off with the most common one, Staphylococcus aureus, where the optimum temperature for Staphylococcus aureus is about 37 degrees, so very close to body temperature, and that's why you find it that it's, it lives well on different parts of the body, so mostly the skin, the anterior part of the nasal cavity. Those are mainly where you're going to find them in the body. They are facultative anaerobes, meaning that they can use oxygen, but they can also survive without it. They have the ability to survive in extreme pHs and in very high temperatures, though, and they have lots of virulence factors. So what are virulence factors? Virulence factors are basically things that are found in each organism that helps the organism invade a body and stay there and spread within the body and would lead to the signs and symptoms of the diseases that are caused by that organism. So we're going to learn about the virulence factors of Staph aureus, and we'll see that it has tons of different factors that helps it become lead to different diseases. So these are all of the virulence factors. We'll see that there are 5 different enzymes that are secreted by Staph aureus and 5 different toxins. So I would like you to know all of them. Okay, so the 5 enzymes and the 5 toxins. We'll go over them one at a time. So the most important enzyme is coagulase. So coagulase enzyme is an enzyme that will coagulate blood plasma. Okay, so this is one of the ways that we can differentiate Staph aureus from the other kinds of staph. There is another enzyme called hyaluronidase. Hyaluronidase helps staph spread through the soft tissue. It digests hyaluronic acid, which is part of our skin. It's found in the soft tissue, in the skin, soft tissue of the joints, and we'll see that it's this enzyme that helps Staph aureus spread throughout the body. Staphylokinase is another enzyme that digests blood clots. Lipase is an enzyme secreted by Staph aureus that digests oils and digests lipids, hence the name lipase, and allows for this bacteria to colonize the skin. Another enzyme is penicillinase. So penicillinase, from the name you can tell that it helps in the deactivation of penicillin. So Staph aureus is resistant to penicillin. We cannot use penicillin to treat Staph aureus infections because of the development of this enzyme. Okay, now the toxins, there's hemolysins. Hemolysins, these lead to the hemolysis of red blood cells. Leucocidins, these lead to the destruction of leukocytes. Enterotoxins are toxins released by Staph aureus that infect the enteric cells. Enteric means the digestive system, so you'll find that this toxin can lead to nausea, vomiting, and diarrhea. Exfoliative toxin, that is a toxin that causes the exfoliation of skin, not in a good way though. We'll see that it can remove layers of the epidermis and cause what is known as desquamation. And then there's a toxic shock syndrome toxin that we've talked about it previously, and it could be potentially fatal because it could lead to organ damage. Okay, so what is the epidemiology and the pathogenesis of Staph aureus? Like I said, it's found in all of the environments that are frequented by humans. So remember that Staph aureus is a normal inhabitant of skin. So anywhere where there's a person, there is going to be Staph aureus, and anything that is touched by a person is going to have Staph aureus on it. So computers, laptops, cell phones, doorknobs. As long as it was touched by a human, there's going to be Staph aureus on it. So it was found on a lot of fomites. Like I said, healthy adults, about almost 50% of us all have Staph aureus. The most important areas where it carried, obviously the skin, the anterior part of the nose, the nasopharynx, and the intestine. So why is it that some of us get sick because of Staph aureus if most of us carry it? Well, usually it will be due to poor hygiene, poor nutrition, tissue injury. So as long as the skin is intact and the staph doesn't really get beyond the skin, then we're good. But if there's any damage to the skin, um, again, we've kind of broke that first barrier. If the patient has a pre-existing infection or a pre-existing condition like diabetes, or if they're immunodeficient, these are all reasons why a person might get a Staph aureus infection. There's also, one of the medications that we give or antibiotics that we give to treat Staph aureus is methicillin. Well, now a lot of the Staph aureus have become resistant to methicillin. So there's a lot of methicillin resistance staphylococcal infection, and that is known as MRSA. Now, so what are the diseases that can be caused by staph? Well, it could be localized to the skin, or it could spread beyond the skin. Okay, so these are examples of localized infections, and I'm actually going to go to the images to describe them. So this right here is folliculitis. This tends to happen, so this is right here, this is on the interior part of the neck of a person where after shaving, especially if there isn't any aftershave or something that is put on the skin that would kill bacteria, bacteria could very easily get into the skin through the hair follicles, causing this folliculitis. So folliculitis is inflammation of the hair follicles because of it being infected with Staph aureus. Now this furuncle is a folliculitis that has developed pus. Okay, so there's a little bit of pus here. And we call that a furuncle, and you can see here that again it is related to hair follicles, but this is a milder infection while the furuncle is a more, maybe a severe, it's not severe, but compared to folliculitis, it is a little bit of a stronger infection. Now, if lots of furuncles combine together, we get a carbuncle. So a carbuncle or a boil is a little, couple of furuncles that have gathered together. And you can see like all of these multiple heads. Now, this last skin infection caused by staphylococcal infections is called impetigo. Impetigo is a skin infection. It tends to happen more in kids. It usually happens around the oral cavity, around the nasal cavity, and that is usually due to, poor hygiene, where there isn't a lot of washing of, after a meal or after eating or after playing and so on, where all the germs kind of spread throughout the skin. So that was more of a local infection. Here are examples of systemic infection where staph can get to the bone, causing a disease called osteomyelitis. It could also get into the bloodstream, and that is known as bacteremia. Staph getting into the bloodstream is usually due to an infected medical device. So maybe they've got a port inserted. So now the staph has access to the bloodstream, and sometimes that bacteria will embed itself on the endocardium, leading to endocarditis. Now, other diseases caused by the toxins could be food intoxication or food poisoning caused by the enterotoxins that lead to the disease of the gastrointestinal tract. And we said that some of the signs and symptoms are nausea, vomiting, and diarrhea. The person could develop a toxic shock syndrome because of the toxic shock syndrome toxin, and that could lead to organ failure. There's also staphylococcal scalded skin syndrome, and that's what you see here, and that is because of the exfoliative toxin. So for each of these, you want to know, because these are all toxigenic diseases, you would want to know the toxin that induced that specific disease. So food intoxication was caused by the enterotoxins. The toxic shock syndrome was caused by its toxin, toxic shock syndrome toxin. And then this scalded skin syndrome, or the exfoliation of the skin, was because of the exfoliative toxin. And here you can see that there is separation of a lot of the epidermis, and the skin basically kind of looks raw in those red areas. Now, other important staphylococci that we have are coagulase negative staphylococci. So Staphylococcus aureus, and that's the one that we've been discussing so far, is coagulase positive. Other ones that are clinically relevant are coagulase negative. So a really good way to differentiate if you suspect that a person has a staphylococcal infection, whether it's Staph aureus or any of the other clinically relevant ones, would to test the for coagulase. Coagulase positive would be Staph aureus. Coagulase negative could be one out of these. So for example, Staphylococcus epidermidis, Staphylococcus hominis, and Staph capitis. Okay, so Staphylococcus epidermidis, that from the name you would think that it's in the epidermis, so it is. It's on the skin and the mucous membrane. It could lead to endocarditis, a bacteremia, and UTI. Staphylococcus hominis, that's found around the apocrine sweat glands. And then the capitis is found on the cap, okay, so on the scalp, on the face, on the and the external ear. All three of these can cause surgical wound infections if they are able to penetrate through the surgical wound. Okay, so again, if you have a patient that had surgery and their wound gets infected, well, the most common cause for a surgical wound infection is going to be staph, okay, since it's usually on the skin. But is it Staph aureus that's coagulase positive, or is it a Staph negative? Sorry, the other staphs, one of these three, that are coagulase negative. Okay, so how do we identify the staphylococci? You want to get your specimen. So the specimen is usually, if there's pus, I'll take some of the pus. Depending on the kind of infection, if it's UTI, I'll get a urine sample, or maybe a blood sample if there's bacteremia. And then we're going to cultivate, you want to do the gram testing, obviously. You want to check that they're gram-positive staph, spheres that are found arranged in clusters. And then you're going to do the coagulase tests. So here's just an example of a flow chart when, what to look for when you know through a gram stain that now you have a staph infection. The first test would be to a coagulase. So it's a coagulase positive, it's a Staph aureus. Coagulase negative, you'd have to kind of go down this list to figure out what kind of staph are you dealing with. And this shows you the coagulase test. On the bottom tube shows that there is coagulation. That thicker white line is coagulase positive for the test, while the absence of that thicker white line on the upper tube is a negative test. Now, what are some clinical concerns when it comes to staphylococcal infections is that, unfortunately, because most staph infections can secrete that enzyme penicillinase, they are now resistant to penicillin. A lot of them are starting to become resistant to methicillin as well. Um, and some strains are actually resistant to every single antibiotic except for vancomycin. Okay, so we do not treat staph infections with vancomycin as a first option because we do not want them to develop resistance to vancomycin. Okay, so some strains are, others are not, and we like to keep it that way. So we do have an option to treat these patients with. If the patient has an abscess, it needs to be surgically perforated and drained. If a person has a systemic infection like an osteomyelitis or bacteremia, this is more of an aggressive, extensive, or a long therapy. So how do we prevent staphylococcal infections? Remember, this is found on our skin. So make sure that we use universal precautions when we're treating our patients to prevent nosocomial infection. So a lot of staph infections happen in hospital settings, especially in surgical units. So sometimes in some hospitals, um, healthcare workers will be screened for Staph aureus, and if it is found, especially in the nose, they are prevented from going into the OR, or patients who are in delivery or nurseries that are dealing with these neonates um, to prevent transmitting that Staph aureus to these patients. Obviously, hygiene and cleaning, personal hygiene and cleansing is going to help a lot with this. Sometimes in patients who we don't have a vaccine yet, but there are trials to to create or to make a vaccine against Staph aureus. So our first concept check here, what test would you do to differentiate Staph aureus from other staphylococcal species? So if you answered coagulase, you are correct.